Okay, so my name is C.Colson. This is for Nursing 210, Professor Dowell's class of Liberty University. Today we are going to be inspecting the scalp, face, neck, hair, skin, and nails, along with all 12 cranial nerves. Bear with me. We're going to start off basically with the upper extremities. We're going to be looking at the skin. It seems to be all intact. Color is good and normal. No redness, no itching, I would assume.
No.
No rash at this time. Okay. Texture is good. Turgor tests. We're going to be doing the tent test on the top to check for dehydration. And at this time, you're actually slightly dehydrated, it looks like. We're going to do the same for the lower extremities, in which we check for a lot of the same as the upper extremities. We're going to take the shoe off here and palpate. We're going to check for pulses and cap refill. This time, cap refill on the lower extremities is less than 3 seconds. And we're going to check the upper extremities while I'm at it. It seems to also be less than 3 seconds. No hair is noted on the patient, which is normal at this time for female pattern. Nail inspection, we're going to be checking for clubbing. If you can go ahead and hold your nails together like this, they appear to not be bowed or clubbed at this time. We are going to be checking head and scalp. Scalp appears to be normal and of normal color with no lesions noted. It seems to be healthy and not dry. Hair is brown in color, and I'm going to go ahead and palpate it. It seems to be healthy at this time, as well as not dry. The pattern within the hair seems to be appropriate for female, and there's no balding or any deficits at this time. We're going to go ahead and inspect perinasal sinuses, which appear to be normal with no crepitus. We're going to test for jaw movement and TMJ. If you can, go ahead and open and close your jaw and move it side to side. There's no clicks, pops, or crepitus palpated or noted at this time, though I'm not thoroughly auscultating. We're going to be checking cranial nerve number 7, which is the trigeminal nerve. Basically, within this time, we are going to check for appropriateness of response. So I've got a soft-sided Q-tip as well as hard-sided end on the Q-tip, and you're going to tell me whether or not it's soft or hard to touch on your face. So you go ahead and close your eyes.
Soft. 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 Hard.
Okay, fantastic. Go ahead and open your eyes. Within opening and closing the eyes, I've also checked for cranial nerve number 7, which is the facial nerve. I'm going to go ahead and have you smile, purse your lips, blow out your cheeks. Fantastic, looks good. At this time, we are going to check cranial nerve number 2, which is the optic nerve. We would do a Snelling's test, which is essentially a long viewed vision test, where I would take a vision card about 20 feet away and verify that she could read each set of letters. I don't have one present at this time. We're also going to do the Rosenbaum's test, which is where we take the vision card and place it about 14 inches off of the patient's field of view and do kind of a nearsighted vision test as well. We can assess for peripheral vision, so if you can just look straight ahead and let me know when you can see my fingers by indicating, just say a word.
Okay. Okay.
About up and
okay.
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 Fantastic. All right. We're going to check cranial nerves 3, 4, and 6, which are the oculomotor, the trochlear, and the abducens. We're going to do the 6 cardinal positions of gaze. If you can, just go ahead and follow my hyphen. Ready? Fantastic. Okay. We're going to inspect the eyes, eyebrows, eyelashes, Go ahead and open and close your eyes for me. Everything appears to be normal at this time, of normal color, and hair is appropriate to a female. The conjunctiva is pink, the sclera is white. I'm going to go ahead and get my pin light here again and check for reactive pupils and accommodation. So if you can, I'm going to dim the lights real quick. Fantastic. Pupils are equal and reactive to light at this time. And if you can, go ahead and remove your glasses. Palpate your lacrimal sacs. Can you close your eyes? Fantastic. Any tenderness? No? Okay, great. You can go ahead and put your glasses back on. We're also going to be assessing cranial nerve number 2 at this time further, but I need to get my scope. Fantastic. So we are going to assess the inner eye at this time. Check for clarity and red reflex. We are also assessing retinal vessels and making sure that the fundus is of creamy color. And of course, when we do our corneal light reflex, we're going to look for that twinkle in each eye. So that basically is about halfway through our assessment at this time. We are going to go ahead and introduce you kind of to the room in which we're in. This is Mary. She is a colleague nurse of mine, as well as a student of the class, and we are in the EEG lab at Spotsylvania Regional Medical Center with no help or assistance at this time. Okay, I can get my phone brought back up here. Perfect. All right, we're going to move kind of to a generalized face and neck assessment. We're going to look at ears. We can see that they are symmetrical and even in size. Let me go ahead and get my other scope here. We're going to go ahead and pull up the canal and look inside, make sure that everything appears to be pink. There's no drainage or any kind of lesions. The tympanic membrane seems to be grayish in color and intact at this time. We're also going to assess cranial nerve number 8, which is the vestibulocochlear with the Weber and Rhine test. This also involves the ears and the hearing. Essentially, the Weber and Rhine test check for conduction of both bone and air. So you use the tuning fork on top of the head, as well as the process, it's a massoid process, and we check for hearing on both sides. You hear that okay? You heard that? Mm-hmm. Okay. Air conduction should be identified longer than bone conduction. We're also going to do what's called a whisper test. We're going to go ahead and have you close your eyes. I'm going to whisper something in each ear to verify that each ear is symmetric. So let's go ahead and have you close your eyes. I'm going to whisper something, you repeat it back to me, okay?
Liberty University.
Okay.
Professor Dell.
Fantastic. Okay. We're going to look at the nose and make sure it's midline and symmetrical. We're going to go ahead and inspect it with a light. Appears to be pink with no drainage, no occlusions. We're going to check for obstructions. So if you can, go ahead and cover one side and breathe. And now the other side. Seems to be okay. Other than that, we're going to go ahead and move down to the mouth and pharynx. Okay? Okay. We are going to go back to the nose, actually. I did forget something. We're going to do our smell test. So if you can, go ahead and close your eyes for me. I'm going to introduce two different objects, and you're going to tell me if you can smell what they are, okay? Go ahead.
Oh,
Okay.
banana hand lotion.
Okay, fantastic. Now we're going to go ahead and progress down to the mouth and pharynx. First and foremost, I'm going to have you open your mouth and inspect, make sure that everything is pink. Go ahead and lift your tongue for me. Okay, fantastic. We are going to, basically by lifting the tongue, we're looking at the frenulum. We are also looking at the Wharton's and Stenson's ducts, which are located sublingual as well as out on the inner cheeks. This is also assessing overall vagus nerve and glossopharyngeal nerves. We're going to have you swallow. At this time, we're checking for tracheal movement to be up and down with no deviation, and everything so far looks good. Okay. We're going to assess cranial nerve number 12, which is the hypoglossal nerve. So if you can go ahead and open your mouth again, move your tongue side to side for me. Fantastic, looks good. We're going to go ahead and move down to the neck and focus on the lymph nodes as well as the spinal processes. So first I'm going to go ahead and look at the processes in the back. Everything seems to be straight with no kind of deviation. I'm going to go ahead and palpate and inspect for symmetry, which everything seems to be good. Some nodes we're going to look at are the pre and post auricular, the occipital, the submental, and as well as the retropharyngeal and the supraclavicular. Essentially, we do that by neck and clavicle inspection, and everything seems to be fine. You should be able to palpate for these, but they should not be palpable. We should be inspecting and auscultating the carotid arteries one at a time, so your patient doesn't pass out. Okay. And you can also inspect and palpate the thyroid, and as long as it's not enlarged, you should not hear anything, but you can auscultate for a brilliant. Fantastic. At this time, we are going to check the last of the cranial nerves, cranial nerve number 11, which I skipped over, which is the accessory nerve. So we're going to have you go ahead and shrug your shoulders. And I'm going to just go ahead and relax. Go ahead and push up against them. Fantastic. And I'm going to go ahead and have you do the same thing, tilt your head side to side, and then go ahead and push against my hands. Okay, on this side. Fantastic. Everything on this patient seems to be within normal limits. I hope that there was nothing I missed. Again, my name is C.Colson, and this is the Nursing 210 class for Professor Dell. Thank you.